Good morning, everyone. Bob Ravenscroft, Vice President here at Bryan Health for our November 17th, 2020 press briefing. Start out, our midnight census last night was 496 patients. We now have tested or administered 31,906 tests, resulting in 4,225 positives. As we look at what's going on inside Bryan Medical Center, we are currently treating 118 COVID-19 patients. 37 of them are from Lancaster County, 81 of them are from counties elsewhere in Nebraska. We additionally have 10 patients in the hospital that are no longer infectious, but are still under our care. There are an additional 12 patients in-house that are pending their test results. All but one of them are from Lancaster County. For the number of patients on ventilators at the current time, there are 15 patients. Only one of them is from Lancaster County. Additionally, there are 3 patients that are no longer infectious that are also still on ventilators. Of all of these COVID patients in-house, 19 of them are in intensive care units, and there are 3 of them that are no longer infectious that are in intensive care. We have a special guest here today, but before that, I want to make one quick announcement. Our urgent care at 84th and Pioneers, that's the Southeast Lincoln location, is now extending its hours until 11. It's 8 a.m. until 11 p.m. every day, Monday through Monday, 7 days a week. This is to expand access to the community and hopefully alleviate some of those things we've talked about that brings patients to the emergency department after hours because urgent cares are no longer open. I'd like to thank all of the physicians. It's not just the ones that deal with inpatient care that are stepping up to the plate to extend the hours of this urgent care. And then one more quick announcement before our special guest. Tomorrow's briefing will feature our CEO, Russ Grunwald, an oncologist, Dr. Nate Green, and the director of the Bryan Cancer Program, Sue Schreiner. And we are so looking forward to bringing the community some good forward-looking news that is non-COVID related. We will also be here to address any of your COVID situations. So at this time, I'm going to turn it over to Dr. Alissa Clough. She is the president of Inpatient Physician Associates. It's our IPA. It is our hospitalist group that they serve Bryan Medical Center, hospitals and throughout the state, notably Columbus, North Platte, the other one. Yeah. So, very connected. She's going to give you the perspective of a physician that is seeing patients, and her group is on a daily basis on what you guys refer to as the front line. She's going to share some images with you to show you what they are dealing with, and I hope you find it as educational and instructive as we can. And I would just like to take this time to thank them. The amount of time, stress, commitment that they're working under and displaying is truly humbling, and I wish we could do more to help them do their job, but they are doing a tremendous job, and I thank you very much for all you're doing for our community and our state, Dr. Clough.
As he mentioned, my name is Alissa Clough. I'm an internist and one of 65 team members of Inpatient Physician Associates. We provide care 24 hours a day and 7 days a week for the hospitalized patients here at Bryan, both COVID and non-COVID, here at Bryan East and Bryan West, serving patients that are admitted through the emergency department as well as transferred in from referring facilities. With this, my team has been on the front lines caring for nearly all of the COVID-19 patients here coming through our front doors. To date, we have cared for nearly 800 patients, all levels of acuity, from those needing just a little bit of oxygen to those needing the ICU and ventilator support. Here on my left, you can see that to date, we have cared for 784 patients here at Bryan, with ages ranging from just 1 or 2 weeks to 97. The average age has been 65, and over almost 6,000 days have been seen with patients in isolation. Unfortunately, we have lost several and many patients, even I think over 10 in the last week. 81 deaths with those ages ranging from 29 to 95 with an average age of 73. We have restructured our operations and have opted to have several COVID physicians each day. Today, we are caring for 265 patients in the hospital, and just over 44% of those are COVID-19 positive, given the numbers that Bob relayed this morning. So with those volumes, we have 8 different physicians working closely with our nursing staff and subspecialists, seeing those patients multiple times a day and working on communicating with the family. Many of you heard from Dr. Jarrett early or later last week at the mayor's conference. It is very taxing on our staff, really all staff throughout the hospital, but particularly it's difficult with the communication with the family and trying to relay what is going on with their loved ones. We too have asked our providers to step up and pick up extra shifts. I recently completed a 10-day stretch on the COVID unit last week, and I had discussed with Bob to perhaps take this opportunity to share a few details and even some x-rays from my week up on the unit. I will be honest, it was a very hard week. We like to heal people and see improvements daily even, based on treatments that we may be providing. While many patients don't have severe illness, many that we are treating develop severe pulmonary disease and viral pneumonia. I have brought together today a couple x-rays of patients that we have cared for since our time in March. And what I would like to relay is that these x-rays are the x-rays that we are seeing every day. Of the 18 patients that I cared for last week, 14 of those patients were on high levels of oxygen and upward to 100% for days. I would go home and tell my husband at night that I felt defeated, as the only thing I could keep telling families was to give it more time and to allow our treatments to take effect. I think a picture is truly worth 1,000 words, so I did want to share these images with you today. I recognize that you may not be medical, but I would like to show you here on the left is an x-ray of a healthy patient. I tell my patients that black is good, black is air. And what you're seeing on the right-hand side is white. White is the pneumonia. This is the inflammation that we're seeing throughout the lungs of these patients that come in severely compromised. On the next slide, again, another patient with bilateral, what we call bilateral, or both sides, infiltrates, or the white, the inflammation, the pneumonia. And another picture. Again, these are all 3 different individuals, but as you can see, they look very similar. I also included a couple images. We often get CT scans for a little bit better definition, sometimes looking for other complications. This was a CT on one of my patients. Again, black is good, white is bad. And on the white here, on the right-hand side image, you can see the infiltrates, particularly in the peripheral, that we have classically described in the past, or you may see in the literature or up in the media in discussing things. You have heard us talk about proning patients, where we ask patients to lay on their stomachs, or even patients that are on the ventilator laying on their stomachs. I had multiple patients last week that we were doing that on. And just as a visual, they're on the right, so you're hoping that as you're laying them on their stomach, the stomach would be on the top of the image. That big, large globular is your heart. Basically, we're laying down so that the oxygen can go to where that black is, so that you can have better oxygenation. I also included a couple images of more complicated patients that we've seen. This patient here had severe deterioration, was actually here over a month. And as you can see, these big, in this situation, the big black areas, unfortunately I don't have a pointer, but they kind of look like circles there on the images. That is basically what we suspect was lung that was dying, tissue that was dying from the infection. You can see the haziness. You'll hear people talk about bilateral interstitial infiltrates or ground glass. You hear that a lot in the media. That would be what you see there, aside from those black circles or cystic areas. So again, that was a very, very sick patient there on the right. And then just 2 other images I brought to share. Something you hear a lot about is increased clotting, and this is a patient here on the right. This is a little bit different image. Here we're looking at blood flow. So the bright right in the middle of the image is blood going from the heart into the lungs. And if you're looking at the picture head on the left-hand side, you can see a large area of gray where that white doesn't continue. That is a very large pulmonary embolism. This patient actually went on to, with the help of our cardiology and thoracic team, to remove that clot, and I'm happy to say did go home. The next example is another very sick patient. You hear about rupturing or what we call pneumothorax. This is air actually around the heart. Again, the black here should not be there. That's air around the heart and the lung, and again, a very sick patient. So in closing, although I certainly just painted some pretty grim pictures, I do feel it's important for folks to understand what we are seeing day in and day out. I'm incredibly proud of our team, and we are very, very honored to be caring for these patients, not only from here in Lancaster County, but across the state. We are fortunate here in Lincoln that our mortality rates are less than 0.5%, and we certainly have learned a lot in the last 9 months on the management of COVID-19. We have celebrated with hundreds of patients that have improved and gone on to discharge. Although, as described on that first slide, we certainly have mourned with the over 80 patients that we have lost. We do have hope, however, on the horizon with promising vaccines and development of new treatments. But until then, I ask that we unify and do our part to prevent infections by doing our part to wash our hands, wear a mask, and watch your distance. We do not want to have to ration care or have to turn down patients in rural Nebraska that need our help. One of the most precious resources that the U.S. system has is not a miracle drug, it is its healthcare workers. And I would just like to echo that, but also put in a comment also about our other frontline workers across the state, our first responders, and even our teachers and educational staff. We are all in this together. We won't fix a pandemic overnight, but we can continue to be vigilant.
Yes, yes and no. It's one of these things that, unfortunately, when you have to cut back on surgeries, you can't just take a surgical nurse or a surgeon per se and throw them into the ICU. But what it is doing is it is allowing them to transition into, in some cases, even non-clinical roles, helping transport, helping some of our screening stations and so forth. But we are repurposing staff wherever possible. So that's what's been kind of interesting when people talk about, well, healthcare can just move resources around and they're learning to deploy resources to other needs. It's just not that simple, and that's what makes the issue really stress-inducing right now, because you just can't move a nurse to another unit, and you can't just move a physician outside of their specialty to another unit. But I guess to some extent, yes, it is freeing up additional staff to move them around. And I think we'll see some of our relief in some of our general care units, more so than in the ICU. Dr. Clough, do you have anything you would want to share there?
I would just add that, one hope is that by freeing up some of those surgeries, we can move those patients, particularly our ICU nurses is where we're feeling probably the biggest stress. And so sometimes those nurses from the surgical units or folks in anesthesia could potentially help in that setting. We're also using a lot of those support people to help us with our PAPR support or PPE. So as we're donning and doffing, as we're going into these units, they're available to help us put those on or take them off and help us clean to just be more efficient.
Currently, right now, we have 117 employees that are not working because of either isolating or a positive diagnosis, and 39 of them are bedside nurses. What is unclear, honestly, is where are they contacting that? We are so PPE'd up here. It's unlikely it's happening, but there's no way of knowing, because essentially this virus is everywhere. They interact outside of the building as well. But yeah, that's another complicating factor when we look at the workforce is the health of our healthcare workers. Yes, we would be included in that. I'm not exactly sure what Pat announced this morning, but our CEO of Bryan Medical Center, John Woodrich, participates in every call that the Department of Health participates in, and if this committee is being stood up, Bryan would have influence. Well, I think you've seen Bryan be somewhat consistent since the beginning. We have been imploring people to do certain things for a lot of times. Even back in June, we were forecasting or foreboding a tough winter as you had the confluence of people moving inside for gatherings and the flu. So it has been something we're watching. I would say, yeah, it's definitely a concern. There are finite staffing resources. There are finite physical capacity. And there is, not a finite number of people who are getting this. It is, if people aren't careful, it's going to keep it. It's math at this point. The more people who are exposed means there are more positives, which mean there are more people who get ill, sick, and die. You can almost project it out now. So it is very, very concerning. And I am really heartened to see the hospitals around the state stand up, begin messaging along with us directly to the public. That's how we're going to do it. I just hope and pray that people listen to people like Dr. Clough and everyone else we bring up here. They're not coming in huge numbers. Again, most travelers are on 13-week appointments, so we are recruiting nurses that are in existing appointments and trying to backfill as much as possible. There's been some success, not in huge numbers. We're really kind of putting our efforts into training progressive care nurses to become ICU nurses. Again, that's about a 6 to 8 week training program as well, and working on some other things we can control on our own. I'm not going to really give specifics on that. I know that the distribution to the general public is going to be different than a closed distribution site that we have at Bryan. If Pat says that, I trust Pat.